Hi guys, it's Dr. Nasser here. Welcome back to another video. In this video, we're going to talk about acute necrotizing ulcerative gingivitis, also known as ANUG. Now, this is a condition you need to recognize quickly because it presents very differently from routine gingivitis. It is acute, it is painful, and it has very characteristic clinical features. So the goal is understand what ANUG actually is, recognize it immediately in the clinic, and know the management approach step by step. Now, what is ANUG? If you look here, ANUG is an acute bacterial infection of the gingiva. It is characterized by necrosis of the gingival tissue, ulceration, and pain. This is not just inflammation, it is tissue breakdown. Now, why does it happen? ANUG is strongly associated with certain risk factors. Now, the key ones are poor oral hygiene, high plaque levels, smoking, stress, and reduced immunity. Now, the important point is, it is not caused by one single factor. Rather, it's a combination of microbial load and host susceptibility. Now, what are the key clinical features? Now, this is where ANUG becomes really easy to recognize. The classical feature is a so-called punched out interdental papilla. Now, these papillae appear cratered, necrotic, and covered with a grey pseudomembrane. Now, what are the associated symptoms? Now, patients often present with severe pain, bleeding gums, halitosis, which is very characteristic, and in more significant cases, fever and lymphadenopathy. Now, this is not just a local condition, it can also have systemic features. But let's look at what's happening at tissue level. If we look deeper, there is a bacterial invasion of the gingival tissue. There is tissue necrosis, the immune system is compromised, and now this leads to tissue breakdown, which is quite rapid, ulceration, and pain. Diagnosis. Now, the diagnosis is mainly clinical. If you see necrotic punched out gingiva, pain and bleeding, and strong halitosis, you should strongly suspect ANUG. Now, radiographs are not usually required initially. This is more of a clinical diagnosis. Now, let's talk about the classical step-by-step management. Now, let's go through the management clearly. Step 1. Acute phase management. First priority, remove the local irritants. Now, this includes gentle debridement, irrigation of the infected area. Important to recognize that don't be overly aggressive initially. The tissue is very sensitive. Step 2. Improve oral hygiene. The patient must be guided to improve plaque control and maintain gentle but effective cleaning. This is essential for the resolution. Step 3. Chemical support. Adjunctive measures may include antimicrobial mouth rinses. Now, these help reduce the bacterial load and support healing. Now, step 4. The systemic management, where indicated. It is where the systemic signs such as the fever, lymphadenopathy, and significant spread. The systemic therapy may be considered based on the clinical judgment. Now, let's address the risk factors. Long-term success depends on reducing smoking, managing stress, improving oral hygiene. Otherwise, recurrence is quite likely. Now, with proper management, pain reduces quickly, tissues become to heal, papillae may partially recover. With more severe cases, you might even get tissue loss. Now, what are the most important takeaways? Now, ANUG, also known as acute necrotizing ulcerative gingivitis, is an acute necrotizing infection of the gingiva. The hallmark feature is punched out interdental papillae. It is strongly associated with poor oral hygiene, smoking, stress, and reduced immunity. Diagnosis is clinical based on characteristic appearances and symptoms. And management focuses on debridement, plaque control, and addressing underlying risk factors. So, stepping back, plaque and risk factors combine, tissue becomes necrotic, papillae are destroyed, symptoms become acute and painful, and treatment focuses on controlling infection and restoring the oral health. Once you recognize the classical characteristic appearance of ANUG, it becomes one of the most straightforward periodontal conditions to diagnose and manage effectively. If you've got any questions about this, please pop it in the comments below. Hope you enjoyed this video. If you do, please give it a like and subscribe. I will see you in the next video.